Welcome to part 1 of the Addiction and Trauma Coping series. This lesson is meant to help the listener understand the connections between trauma symptoms and addiction, learn coping skills to bring these symptoms and addiction under control, promote healing and acceptance, and to reduce relapse risk by using coping strategies for both addictions and problems related to trauma. You may be wondering, what is trauma? A simple answer is, trauma is the response to a deeply distressing or disturbing event that overwhelms the individual's ability to cope. And it also causes feelings of helplessness, diminishes the sense of self, and impedes their ability to feel a full range of emotion and experiences. Trauma is often thought of as originating from an event, but there's also complex trauma, which stems from chronic long-term exposure to an environment that is life or self-threatening, sexually violating, emotionally overwhelming, or neglectful, and it alters the development of the self by requiring survival to take precedence over normal psychobiological development in a child. In addition to recovering from substance abuse, many of us are also trying to cope with trauma-related symptoms. Some of us may have been diagnosed with PTSD or another anxiety disorder, like generalized anxiety, social anxiety, and agoraphobia, just to name a few. Others may not even recognize this as an issue for them. Trauma history is a very common occurrence for those struggling with substance abuse disorders. According to the Substance Abuse and Mental Health Services Administration, in the United States, 61% of men and 51% of women report exposure to at least one lifetime traumatic event. That's a lot. And when it comes to those in treatment, though, for mental health or substance abuse disorders, that number soars to 90%. So what are these connections between addiction and trauma-related disorders? People who abuse alcohol and other drugs are far more likely than others to find themselves in risky situations and suffer trauma. Likewise, people with trauma-related disorders are at a higher risk of becoming addicted to alcohol and other drugs, as they often try to self-medicate to relieve their anxiety, depression, or other symptoms. After this lesson, you'll be asked to complete 2 self-reflections. In some cases, people experience traumatic events as a result of their drinking, drug use, or other high-risk behaviors. You will describe any ways that you feel your addictive patterns have led you to suffering traumatic experiences. Imagine the dangerous situations that people get themselves into when they're using substances. This could be driving under the influence, causing an accident, getting a DUI, getting in arguments with family that get out of hand. There are so many ways that our use has affected our lives. Sometimes the connection between addiction and trauma works in the other direction. The traumatic experiences or other anxiety problems come first, and when the person uses substances or behaviors to temporarily block the pain, they can get hooked. Have painful experiences led you to drink, use, or otherwise act out addictively? Oftentimes, we'll hear about patients who had social anxiety or other anxiety issues like low self-esteem or depression, and when they were first introduced to alcohol or other substances, they found that it made all those bad feelings go away. So they wanted to keep doing that because they wanted to get rid of all those bad feelings. Did you have things that were happening before your addiction started that made addiction way easier to slip into? In the next lesson, we're going to discuss trauma-related symptoms. Thank you for choosing the Recovery Village. If you or a loved one are struggling with mental health or substance abuse and would like to find out more about the programs we offer, please reach out to us directly at 855-387-3291.